1. A patient taking lithium reports increased thirst and frequent urination. What is the nurse's priority action? Answer. Check serum lithium level and assess for signs of toxicity. Rationale. Polyuria and polydipsia may indicate early lithium toxicity due to impaired renal concentration ability. 2. A patient started on allopurinol develops a rash and fever. What should the nurse do first? Answer. Stop the medication and notify the provider immediately. Rationale. A rash with allopurinol may signal Stevens-Johnson syndrome, a potentially fatal hypersensitivity reaction. 3. A patient is receiving gentamicin and develops a decrease in urine output. What is the nurse's first action? Answer. Evaluate renal function tests and report findings. Rationale. Gentamicin is nephrotoxic, and oliguria may indicate early kidney injury. 4. A nurse notices a prolonged QT interval on a patient's ECG who is on ziprasidone. What is the priority? Answer. Notify the provider and monitor for signs of torsades de pointes. Rationale. Ziprasidone can prolong QT interval, increasing the risk of life-threatening arrhythmias. 5. A patient prescribed ethambutol for tuberculosis reports vision changes. What should the nurse do? Answer. Discontinue the drug and arrange an ophthalmologic evaluation. Rationale. Ethambutol can cause optic neuritis, requiring prompt drug discontinuation to preserve vision. 6. A patient on oral iron reports black stools. What is the nurse's best response? Answer. Reassure the patient that this is a harmless side effect. Rationale. Black stools are a common, non-serious effect of oral iron supplementation due to iron oxidation. 7. A patient taking doxorubicin develops new shortness of breath. What should the nurse do immediately? Answer. Assess for signs of cardiotoxicity and notify the provider. Rationale. Doxorubicin is associated with dose-dependent cardiomyopathy and heart failure. 8. A patient receiving heparin therapy has a platelet count of 75,000. What should the nurse do? Answer. Discontinue heparin and assess for signs of heparin-induced thrombocytopenia. Rationale. A drop in platelets may indicate HIT, a serious immune-mediated complication requiring cessation of heparin. 9. A nurse prepares to administer amphotericin B. What must be done prior to infusion? Answer. Premedicate with antipyretics and antihistamines. Rationale. Amphotericin B often causes infusion reactions such as fever and chills, which can be reduced by premedication. 10. A patient receiving rosuvastatin complains of dark-colored urine and muscle pain. What is the nurse's immediate concern? Answer. Assess for rhabdomyolysis and notify the provider. Rationale. These are signs of rhabdomyolysis, a serious statin-related adverse effect leading to kidney damage. 11. A patient is prescribed digoxin and reports seeing yellow halos around lights. What should the nurse do first? Answer. Hold the medication and assess serum digoxin level. Rationale. Visual disturbances may indicate digoxin toxicity and require immediate intervention. 12. A nurse is administering epoetin alpha. What lab value should be monitored closely? Answer. Hemoglobin level. Rationale. Epoetin alpha can increase hemoglobin levels too rapidly, increasing the risk of thromboembolic events. 13. A patient on hydroxychloroquine for lupus reports blurred vision. What is the nurse's response? Answer. Hold the medication and refer to an eye specialist. Rationale. Hydroxychloroquine may cause retinal toxicity. Early detection is critical to prevent vision loss. 14. A patient on amiodarone presents with a persistent dry cough. What is the nurse's first action? Answer. Evaluate for pulmonary toxicity and notify the provider. Rationale. Amiodarone can cause life-threatening pulmonary fibrosis, especially with long-term use. 15. A patient on isoniazid for tuberculosis complains of numbness in hands and feet. What is the best nursing intervention? Answer. Recommend vitamin B6 supplementation. Rationale. Isoniazid can cause peripheral neuropathy, which is prevented with pyridoxine, vitamin B6. 16. A nurse is administering morphine and the patient's respiratory rate is 8 breaths per minute. What is the priority? Answer: stop the medication and prepare to administer naloxone. Rationale: respiratory depression is a critical adverse effect of opioids requiring immediate reversal. 17. A patient on enalapril reports a dry, persistent cough. What should the nurse advise? Answer: contact the provider to consider switching to an ARB. Rationale: ACE inhibitors often cause a dry cough due to bradykinin accumulation. ARBs are an alternative. 18. A nurse is educating a patient on disulfiram therapy. What food must be strictly avoided? Answer: any product containing alcohol, including sauces or cough syrups. Rationale: alcohol consumption with disulfiram causes a severe reaction and must be strictly avoided. 19. A patient taking sildenafil experiences chest pain after sexual activity. What is the nurse's first response? Answer: instruct the patient not to take nitrates and seek emergency care. Rationale: sildenafil combined with nitrates can cause life-threatening hypotension. 20. A patient receiving metformin reports unusual fatigue and rapid breathing. What should the nurse assess? Answer: evaluate for lactic acidosis by checking serum lactate and pH. Rationale: metformin can cause rare but serious lactic acidosis, especially with renal impairment or dehydration. 21. A patient on warfarin therapy presents with dark tarry stools. What is the nurse's priority action? Answer: hold the warfarin and notify the provider. Rationale: tarry stools may indicate gastrointestinal bleeding, a serious adverse effect of anticoagulation. 22. A patient taking vancomycin for suddenly develops flushing and itching of the face and upper body. What should the nurse do? Answer: slow the infusion rate and monitor for red man syndrome. Rationale: red man syndrome is a histamine-mediated reaction often caused by rapid infusion of vancomycin. 23. A nurse administers an albuterol nebulizer treatment. What side effect should the nurse monitor for? Answer: increased heart rate. Rationale: albuterol is a beta agonist that may cause tachycardia and palpitations. 24. A patient prescribed methotrexate for rheumatoid arthritis reports mouth sores and fatigue. What is the nurse's concern? Answer: assess for bone marrow suppression. Rationale: methotrexate can cause myelosuppression, leading to anemia and mucositis. 25. A patient is started on sertraline. What should the nurse emphasize during early weeks of treatment? Answer: monitor for increased suicidal ideation. Rationale: SSRIs can increase suicidal thoughts, particularly in young adults during initial treatment. 26. A patient on furosemide reports leg cramps and weakness. What is the nurse's immediate intervention? Answer: assess serum potassium level. Rationale: furosemide is a loop diuretic that can cause hypokalemia, leading to muscle cramps and weakness. 27. A patient is prescribed bupropion for smoking cessation. Which condition is a contraindication for this drug? Answer: history of seizures. Rationale: bupropion lowers the seizure threshold and is contraindicated in patients with seizure disorders. 28. A patient receiving mannitol becomes confused and develops crackles in the lungs. What should the nurse do? Answer: stop the infusion and evaluate for fluid overload. Rationale: mannitol may lead to pulmonary edema, especially in patients with renal or cardiac dysfunction. 29. A patient on clopidogrel is scheduled for surgery. What action should the nurse take regarding the medication? Answer: notify the surgical team and anticipate holding the drug. Rationale: clopidogrel increases bleeding risk and is usually stopped before surgical procedures. 30. A nurse is teaching a patient on levetiracetam. Which safety concern must be addressed? Answer: report mood changes or suicidal thoughts. Rationale: levetiracetam may cause behavioral changes, including aggression and suicidal ideation. 31. A nurse is administering 4-promethazine. What is the most serious complication to monitor for? Answer: extravasation leading to tissue necrosis. Rationale: promethazine is highly vesicant and can cause severe tissue damage if extravasated. 32. A patient taking prednisone for lupus presents with moon face and bruising. What is the nurse's interpretation? Answer: these are signs of Cushingoid side effects. Rationale: long-term corticosteroid use can lead to features of Cushing syndrome. 33. A nurse is caring for a patient on methyldopa. Which adverse effect must be monitored closely? Answer: hemolytic anemia. Rationale: methyldopa can cause hemolytic anemia, indicated by fatigue, pallor, and jaundice. 34. A patient taking azathioprine develops a low white blood cell count. What is the appropriate nursing action? Answer: hold the drug and notify the provider. Rationale: azathioprine can cause immunosuppression and leukopenia, increasing infection risk. 35. A patient on naloxone begins to complain of intense pain and agitation. What is the nurse's explanation? Answer: these are expected effects due to opioid reversal. Rationale: naloxone reverses opioid analgesia, which can result in sudden return of pain and withdrawal symptoms. 36. A nurse is reviewing a patient's medications and sees sildenafil and nitroglycerin prescribed. What is the priority action? Answer: notify the provider and withhold the medications. Rationale: concurrent use can cause fatal hypotension. These drugs must not be given together. 37. A patient is taking fluoxetine and develops a high fever, agitation, and muscle rigidity. What condition should the nurse suspect? Answer: serotonin syndrome. Rationale: fluoxetine and SSRI can cause serotonin syndrome when combined with other serotonergic drugs. 38. A patient taking phenelzyne reports a headache after eating aged cheese. What is the nurse's immediate concern? Answer: hypertensive crisis. Rationale: MAIs like phenelzyne interact with tyramine-rich foods, causing life-threatening hypertension. 39. A nurse is monitoring a patient on methocarbamol. What central nervous system side effect requires intervention? Answer: drowsiness and confusion. Rationale: methocarbamol is a muscle relaxant that can cause CNS depression, especially in elderly patients. 40. A patient on amlodipine reports swelling of the ankles. What is the nurse's best response? Answer: elevate the legs and monitor for peripheral edema. Rationale: amlodipine, a calcium channel blocker, commonly causes dependent edema due to vasodilation. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!